How come UK is one of the few countries that offers a vaccination program for the elderly people?
Okay, well, in UK we have a national immunisation programme, and we don't really distinguish it as a programme for elderly and a programme for children, for example. We have a programme that offers vaccination across the life course, and so we don't specifically go out to build a vaccination programme for elderly people. What we do is we look at what diseases affect our population the most, how much morbidity and mortality they cause, in which groups of people do they cause those illnesses, and if there is a vaccine to prevent it, can we then use that vaccine in certain groups or in the whole population, whatever it might be. And we have to base that on ultimately whether the vaccine is cost effective. So if we pay the money to provide people with the vaccination, and we pay the cost of the vaccine as well as paying the cost of the doctor or the nurse to give it, will we save that money in our national health system because we've immunised and protected somebody? So we have to have that balance. If it costs more to do the vaccination programme than we're going to save in healthcare costs, then unfortunately we don't introduce a programme. But for the vaccines we do give in UK to our elderly people, to people over 65, flu, pneumococcal, shingles, they've all been found to be cost effective. That is, that if we give them to those age groups, we prevent a lot of illness, a lot of disease, in some cases death, and that is worth more money than we actually spend on the programme.
Based on the results of the vaccination program in UK, what is your recommendation for Sweden moving forward in terms of preventive care for people 65 years or older?
Okay, well, in Sweden you'll need to actually look at all the epidemiology of these vaccine preventable diseases, and you'll have the same diseases. You'll have flu and pneumococcal disease and shingles infection, but your epidemiology might be different to ours in UK, so it may affect different groups. You might have different strains of pneumococcal infection, so the epidemiology is really important to look about who's it infecting, and then you have to do some estimates of how much will it cost to deliver the vaccine program. So how much might the vaccine cost to buy, and how much will you have to pay staff to give it? How much is it going to cost to, say, advertise it to your population, and so on, and compare that to the cost of healthcare currently from caring for people who get these diseases without the vaccine in place. And I suspect then that you will have to do your own cost benefit analysis here in Sweden about whether it's affordable for you to do in Sweden, but also to predict what you hope to get out of a vaccine program, what you might eventually see for your population, and it will be different in each country. So it's very important that that sort of groundwork is done here in Sweden as well.
But what do you think is the reason that other countries, for example Sweden, hesitates to do the same as UK?
I think it's because essentially these programs do on the face of it seem very expensive, and they hesitate maybe because whilst it might be cost beneficial or cost effective in that you save that money in your health system later, you don't actually get the money. So just because you stop something happening, you don't see those savings. So for people who are responsible for health economics, it's quite difficult. It's quite easy if you have somebody who's sick and they're costing healthcare, they need lots of support or whatever, drugs and whatever, and then a miracle drug comes along and they don't need all those other things and you can cure them, then you can actually say, well, we would have spent this much money and now we've saved it. But with vaccination it's a bit more difficult because you prevent the thing you're working to prevent never happens. So trying to convince an economist that if we do nothing, we may get all these cases of flu, we may get all these cases of pneumococcal disease, we may get all these cases of shingles, and they'll cost us this money. But if we spend this money now, we won't get them. And quite often people who are responsible for financing will say, I'm not bothered what's going to happen in the future. I don't have that much money now. So it's about changing your whole mindset to say invest now for the future. That may be why it hasn't happened here. It could also be that your delivery costs are very high. Maybe your doctors and nurses demand lots more money than they do in England. I don't know. The vaccine list prices are high, certainly for shingles vaccine. It's an expensive vaccine. In UK, we do negotiation with the companies to get best vaccine prices. And again, each country will have to do that. And it depends on your levers and your relationships with some of the companies sometimes to get good prices. So there are lots of different factors why some countries have not actually made that leap to do these things.
Yeah, and some might say that vaccines may cause a lot of side effects that we don't really know much about. What is your thoughts about that?
Okay, well, I'm an immunisation advocate. The effects of these diseases far outweigh any side effects from a vaccination. If you're in support of vaccination, you're always on the back foot, because I cannot say to you, have this vaccine, it's completely safe. I can't say that to you. Just like I can't give you a tablet that you can buy in the pharmacy and say, take this very, painkiller. You might have a reaction. You might have a reaction to a vaccine. So no one can ever say they're completely safe. All I know is they save many lives and they save a lot of morbidity, a lot of people's pain and suffering, and they save in terms of people being able to carry on working or care for their children properly or whatever it might be. And yes, there will always be some side effects. I believe in the majority of patients, they're minor, they're transient, they only last a day or so. If people get from flu, they get a bit of a sore arm. But actually, if they caught influenza, they'd be in bed for 5-10 days, very ill. So you can never say they're completely safe. You just say that they are as safe as they can possibly be, and any detrimental effects of the vaccine are so much smaller than the detrimental effects of the disease.
I see. So can you tell me about the response from the people who has been offered to be a part of the vaccination program, both positive and negative?
Okay, so in UK we get about 70% of our over 65-year-olds accept a flu vaccine. It's not as high as we would like it to be. The World Health Organization want all countries to immunise 75% of their elderly. We struggle to get higher because unfortunately there are still some people who think that flu vaccine gives you flu, and that is because when you have a flu vaccine you get an immune response which gives you a blocked nose and it makes your joints a bit achy, and people are not always, that isn't always explained to people. So quite a few people think, well, I'm not having my vaccine again because last year it gave me flu. The fact they were a bit achy for 2 days. So it has a bit of an image problem in UK, and there are quite a few people who don't accept their flu vaccine. But we know that 70% coverage amongst the elderly, and we also do our children with flu vaccine now. We're gradually doing more and more children, and that is reducing the transmission of flu in our communities. So even people who don't have their flu vaccine are protected by the fact that a lot of other people do have it. So there's less flu around. In terms of shingle vaccine, it seems to be very well received. We do have a problem that I think not many of the public know it's available to them, because the way the program is set up means that the doctors don't actually have to invite them. So some of the elderly are not aware that they can have this vaccine. So uptake isn't as high as we'd like it to be, but generally it's well accepted, and we don't hear people complain about it. So that's good. The pneumococcal vaccine, they only get it once in their lives, and it hardly has any side effects. People have it, we never hear from them again with any problems. So, and the uptake of that, by the time people are 75, most of them have had it, well 80% of them have had their pneumococcal vaccine. They just get it once in their lifetime. So generally the pneumococcal is exceptionally well received.
So if we look into the future, what can we expect? Is this kind of program something that will be a global effort?
Well, I think a lot of developed countries, so high and middle income countries, are already doing pneumococcal, shingles, you know, so the Americas are, and a few of the European countries are considering it. I'm not sure it'll be a global effort, for example, like the elimination of smallpox was a global effort. I don't believe we'll ever eliminate influenza because the virus just changes constantly. But it is a World Health Organization directive to immunise your population against influenza, so it may become more of a global push on it. But actually I think that globally there are some new and emerging infections that occupy people's resources to think about, so Zika, Ebola, you know, people are concentrating on those, and most people recover from influenza, except maybe some of the elderly. So I'm not sure it'll be a massive global priority to try and give these vaccines in every country.
So last question, do you think Sweden will follow UK and offer a vaccination program for people 65 years and older?
Well, I would say that Sweden needs to assess each of those programs on their own. I think to just talk about a program for the elderly, it's, for me, these are individual programs, and you know, Sweden needs to assess what's the burden of disease, how much does it cost the country, how much could you save in terms of morbidity and mortality, and hopefully they will certainly think about shingles vaccine. It is expensive, but these elderly patients don't recover well. So I think shingles is a good one to go for.